Early in the show, of course, you heard a breast cancer survivor describing how she lost her health care plan because of the president's law. Well, she's not alone, not by a long shot. John Roberts has been digging into this, and when John Roberts digs into something, it's like a dog on it with a bone. And, man, he's got some wild stuff. John.
We've got a very big shovel. You need one around here. Neil, we know from industry experts that as many as 10 million people could get kicked out of their current health care plans. The president pointed out earlier in your fine program, told people to shop around. Well, that's what Betsy Tadder has been doing. She's from Rockton, Illinois. She is a dental assistant and administrator. She got a notice in the mail recently that her current plan is being canceled because it does not include Obamacare mandated maternity coverage. She's 52 years old and says she doesn't need maternity coverage. She was told that to find a comparable plan to the one that she has, her premiums would double, so she went on the Obamacare exchange and the website to find something she could afford.
There is a policy on the website that I could stretch my budget for and afford it at $541 a month, but the deductible with that plan is $12,700. I can't afford a deductible of $12,700 if something should happen to us.
So Betsy Tadder says she is going to have no choice as of January 1st other than to let her coverage lapse, roll the dice, pay the fine, and hope for the best for her family. Same thing with Kay Joyner. Here's a small business owner in Griffin, Georgia, just south of Atlanta. He recently got a notification that his policy premiums were going to increase by about 70%. He started to look around, so he couldn't find anything that he could afford. He's out there trying to make ends meet, create jobs, says that health insurance may in fact be an expense that he cannot afford.
It was going to be well over $400 a month. I'm a single individual. I've got a business to run. I've got 8 employees. I have to make a payroll every week and pay for fuel and other things for my company. It just, wasn't going to work at that high a price.
Now, don't forget, both of these people like the insurance that they had. And remember what the president said. If you like the insurance you've got, you can keep it. One other thing that these two have in common, Neil, they both make too much money to qualify for subsidies under Obamacare, but not enough money that they can afford health insurance, Neil.
Thank you, John, very, very much. In the meantime, it is now official. It is a mess. And here's what's scandalous.